is Dr. Monika. I am consultant gynecologist and IVF specialist at Narang Medical College and Hospital, Ludhiana. As we all know that November is being celebrated as a prematurity awareness month. So I'll be talking on this topic only. Prematurity. Now what is prematurity? Prematurity is we take when the delivery occurs before 37 weeks. See, in local language we take the duration of pregnancies as 9 months, and in medical terms we take it properly as 9 months and 7 days. And when we break this into weeks, it gets as around 40 weeks. So any delivery occurring before 37 weeks is termed as premature delivery. If we further go into a little detail, we may know that it is further subdivided into extreme prematurity and a moderate prematurity. And extreme prematurity is if delivery occurs before 28 weeks. And the moderate prematurity is when the delivery occurs between 28 to 30 weeks. And anything beyond 30 to 37 is termed as prematurity. What are the risks of prematurity? What are the disadvantages of prematurity? See, nature has given enough time for everybody to grow up, and if anything goes beyond that or before that, it is not natural. The development of baby takes a good of 7 months at least, and further if we go a little further detail, the lung maturity of the baby occurs at around 34 to 35 weeks. So if the delivery of the baby occurs anytime before 35 or 37 weeks, the lungs of the baby may not be that mature to handle the stress of life. So the main risk to the baby is that lungs may not be mature, the respiration may not occur properly, and the complication can be at various levels, like the brain development levels, the eyes development level, and the limbs development level. What are the risk factors through which we can identify what are the women who are at risk for this preterm delivery? The women who are at risk are mostly the prematurity delivery occurs in women who are at extremes of their age, like teenage pregnancies or the elderly pregnancies. In elderly pregnancies, they can be beyond 35 to 40 years. So because their body is not healthy enough to hold a pregnancy, or the mother has any associated disease like diabetes, hypertension, or any other chronic illness, chronic kidney problem, chronic heart problem, any problem occurring prior to pregnancy can have this implication on the pregnancy. If the mother is having a high level of any kind of emotional or physical stress, or she is having chronic infection, maybe the UTI, urinary tract infection, or any other infection in the body which is chronic, she is at the risk of preterm delivery. Or the mother's uterus is not normal, either it is a septate uterus or there is a biconvate or uniconvate uterus. As the shape of the uterus is not normal, the uterus is not healthy enough to hold the baby for 9 months. So the preterm delivery occurs. Also, there can be certain fetal factors. Fetal factors as in the problem with the baby, which can lead to preterm delivery. Now what can be the problems? The problem with the baby's lung development or the cardiovascular development. Any problem, some kind of problems with the baby can also lead to preterm delivery. What are the signs and symptoms that a lady can look for? The lady can look for proper, she needs to understand what is the difference between a vaginal discharge or a early leakage. Early leakage looks like a bilkul watery urine-like discharge. Sudden profuse discharge, that is a sign of that bag of water has ruptured. If that occurs, the lady should immediately report to the hospital. She should not wait and watch at home at all. She might have a few discharges. Other than this discharge, it might be thick, not that watery. That can be a normal discharge also. That can be due to infection also. Even in that case, she needs to go to the doctor. or she experiences sudden pain, or there is a history of fall or accident, she definitely has to go to the hospital. Preterm delivery still is a leading cause of perinatal and neonatal morbidity and mortality. We need to take care of this. Thank you.